So today, I'm gonna do something that many of you have been asking me to do for quite a while now. In this video, I'm gonna take a look at a video from the Knees Over Toes guy.
Your knees go over your toes every time you go downstairs.
Is he legit?
And evidence only shows that the stronger you are with your knee over your toe,
Does he have any idea what he is talking about?
the stronger you are at full bend,
I don't know.
the more protected your knees.
But I'm gonna react to his reverse out knee pain video part 1 to see if I can figure that out.
Listen up, everybody. I have some news.
Hey interns, I'm Dr. Chris Raynor, and I am not your everyday ortho. I teach you about injuries, orthopedic surgery, and medical topics in a way that's easy to understand and entertaining. Today, I decided I'm gonna watch a video from Ben Patrick, the Knees Over Toes guy, and share my thoughts about the statements and the ideas that he presents in the video. Stay tuned to the end where I sum it all up for you. Now, before I get started, I will say that I have reached out to Ben Patrick and invited him to a discussion on my other channel. He politely declined, but he did point me to another podcast interview that he was featured on for answers to my questions. If you like this video and you want me to do a more in-depth review, let me know in the comments down below and I will analyze that video. But enough of the bag of long talking, let's get to it.
5 minutes going backwards. So these are the 4 things I wish I knew. If I would have known these, never would have had bad knees.
So 28 seconds in, I don't know what these exercises are yet, but it's important to remember that the knee is a complex hinge joint that can facilitate a number of types of movement. It has many structures that include ligaments, menisci, articular cartilage, and bony structures, many of which may be potential source of pain. While it is crucially important to optimize strength, flexibility, and mobility to maximize function and eradicate pain, there is no guarantee that these 4 exercises, or any 4 exercises for that matter, will do it. Although there are general reasons for knee pain or a bad knee, the specific causes of knee pain in each person are unique, and therefore the treatment of that pain requires a unique and tailored approach. Bad knees are a multifactorial problem that can be related to dysfunction, anatomy, trauma, infection, or disease, so sometimes something other than just exercise is required. But having said that, I am a big fan of active progressive exercise as a treatment for many forms of non-surgical joint pathology.
So we're going to start 5 minutes right here. And we're just going to go backwards.
I do like his straightforward approach to pain symptoms. Find the causes of the knee pain and then reverse engineer exercises to eliminate that cause. I know that this seems rather straightforward, but it is amazing how many people just want to take a shortcut to feeling better without putting in work to address the deficits at the root of the pain symptoms or dysfunction. Unfortunately, there are no quick fixes.
You can do so. You.
Let me repeat that. Unfortunately, there are no quick fixes.
Okay.
Everything requires work. Sometimes a whole crap ton of it. And not just any exercise, but exercise that is specifically directed towards the deficit causing the pain or dysfunction. Of course, this is most applicable to problems with strength, flexibility, or mobility, and less so for structural issues, infections, or disease. But in general, stronger is better and is associated with less pain symptoms.
And we're just going to go backwards. I'm not sure we have an exact timer.
Walking backwards with resistance.
Now notice, Marcus and I, we're able to pretty much just jump on here.
This is basically a closed chain leg extension exercise. This is a great variation of the leg extension. It is scalable, and in this variant, it is quite suitable for beginners or those who have active knee pain symptoms. There is ongoing controversy about whether knee extensions are suitable for the rehabilitation of postoperative patients, particularly in ACL reconstruction patients. In that population, there is concern about excessive tension on the ACL graft that might cause graft rupture. To prevent this problem, I instruct my patients to avoid open chain knee extensions in favor of closed chain quad strengthening exercises. For clarification, the easiest way to distinguish between open and closed chain exercises is to look at the foot. If the bottom of the foot is touching the floor or the weight being moved, then it is likely a closed chain exercise. If the weight is somewhere else, like on the shin, then it's open chain. In my experience, I find that patients have more difficulty with open chain exercises, so I prefer them to start with closed chain exercises and only incorporate open chain exercises once they progress to an advanced level of training. The most important key when performing this exercise is the position of the knee relative to the foot and the mechanical axis when performing the exercise. For more on that, you can check out my video on how not to tear your ACL.
Actively in knee pain, I would go much slower for 10 minutes. You see that? So you never want to work at a pace that causes you any pain or discomfort.
I am not sure about Ben's level of training or what certifications that he holds, so there are two things that are key here. First, he has regressed the exercise for beginners, or for those who are actively in pain. This is appropriate and the safest way in which to get people doing the exercise and achieving success through the exercise. Scale the exercise to their level and progress to higher difficulty levels as their performance and pain levels improve. Second, Ben advises to avoid a pace of work that causes discomfort or pain. Again, this is appropriate for a coach without formal medical training, and the safest way to have clients self-monitor their activity level. For the record, I will say that rehabilitation is slightly different than pure training. When rehabilitating, the person performing the exercise is working from a deficit of some sort, after injury, surgery, or both. As a result, there is usually some level of discomfort that is associated with the exercise, and this is normal and quite often necessary. I advise my patients while performing rehab exercises they should work through their discomfort until it surpasses moderate levels. This means that when experiencing pain on a scale of 0 to 10, where 0 is no pain and 10 is pain bad enough you will pay me money to cut it off with a rusty butter knife, discomfort that is within 5 to 7 is acceptable. Pain that is greater than or equal to 8 to 10 is a signal to stop what you are doing. Pain symptoms should always resolve quickly after the exercise is completed.
The foot will stay flatter and it'll become an exercise more for the upper quads and the hips. Whereas, you see, if I were to reach there, that's a knee exercise.
I like how Ben has modified his body position here to start challenging the knees over toes position, which really targets the VMO, or teardrop portion of the quadricep muscle. This is an effective means to direct the benefits of this exercise to the desired area of the muscle.
If you only get one training concept out of this, it's to understand that every exercise scales to your level. No joke, 10-minute backward walk a day is actually one of the best things you can do.
I like that he states that every exercise is scalable to whatever level. By changing body position, lever length, or a host of other aspects, you can tailor exercises to whatever skill level is required. Occasionally, this may require some creativity when determining what aspect of an exercise to modify, but most exercises will have several variations that will allow the exercise to be tailored to each individual.
Anyone older in your life, that could change their life in terms of preventing cartilage breakdown that winds up in knee replacements.
Backward walking is a great way to introduce closed chain knee extensions and to facilitate VMO, or quadricep strengthening, into your day-to-day routine. It will strengthen the quadriceps effectively, particularly if you are walking up an incline. And strong quadriceps are beneficial for optimal patellar tracking and the elimination of knee pain. However, to my knowledge, there are no studies that directly tie backward walking to a reduction in the incidence of cartilage degeneration and knee osteoarthritis. Backward walking, when combined with conventional physical therapy, has been shown to reduce pain and functional disability, and to improve quadricep strength in patients with osteoarthritis, balance and stability in patients with rheumatoid arthritis, and muscle strength and gait mechanics in patients with ACL rupture. While it can be said that backwards walking is a beneficial exercise for a number of reasons, it cannot quite be said that it will prevent cartilage damage and prevent knee replacement, because that ain't a thing.
I want to get across these 4 points. So you see, the first thing we're trying to understand is just that whatever's hurting our knees, the stronger we are in reverse of that, the less chance we have of the knee pain.
The stronger you are in reverse of what is hurting your knees, the less chance of knee pain. This is a simplification, to be sure, but I think that from a functional standpoint, this is more or less true. I don't think that this applies to structural problems, which often requires a structural or a surgical solution, but functional problems are certainly fair game.
Marcus is going to do a reverse step up. So going this way, now he has to be strong that way. So the stronger he is this way, the more protected.
The reverse step up is a variation of the Poliquin step up. This is a great exercise for quadricep strengthening with a VMO focus.
This right here would have caused me excruciating knee pain. This right knee had torn ligaments that I didn't even operate on. That's actually what drove me to become really good with knees. The left one has a partially artificial kneecap. The right one had tears. I didn't operate on it.
Ben has successfully rehabilitated himself after suffering injuries to his right knee and debilitating degenerative changes to his left knee. This is admirable, and I commend Ben on his persistence and diligence to his rehabilitation. Furthermore, I will always recommend that patients should maximize their strength and flexibility as part of their rehabilitation and rehabilitation programs. However, it is important to understand that there are many causes of knee pain or pathology, some of which require treatment other than strength, flexibility, and mobility training.
You can do this exercise without weight. You can flip it around. You can go less range of motion and assisted. The most important thing is not just jumping in and trying half your body weight for 20 reps. You can do this exercise at some level.
Ben gives clients and viewers permission to scale the exercise demonstrated as required to suit their level of ability. Patients need to feel comfortable with the exercises that are being presented as attainable for them. Allowing them to scale the exercise to their level of confidence is a good way to maintain a high level of confidence with the exercise program to improve compliance and adherence.
Well, I didn't have to live with knee pain. People don't have to live with knee pain. It's in your control. That's such an important concept. Negative weight, your body weight, positive weight. All right.
I also like how he clearly outlines the level of scaling that is applicable to the exercises being performed. Negative body weight, positive body weight.
On this rep, keep your heel down. Notice the knee, okay? Now lift your heel. Now try to lift your heel. It makes the knee go farther.
So here we have the variations of the reverse step up.
First, we do it with the flat foot, which is easiest. Then we manually put the slant board there, and only then do we remove the slant board and put it together.
We have the Patrick variation with the flat foot, the Poliquin version with a supported plantar flexed ankle, and finally the Peterson version with an unsupported plantar flexed ankle.
Could you just jump right into this? Sure, you could, but why not build it patiently?
Ben encourages people to take their time working through the progressions rather than rushing to achieve a particular goal. In this manner, the process is the goal rather than trying to achieve some particular number. He encourages people to understand what the process is doing and to use it to its full advantage rather than just doing the exercise for the sake of doing the exercise. The goal is to strengthen the knees as much as is possible. This will be achieved by maximizing the time under tension. Taking time with the exercise repetitions will accomplish this task.
So I think that's an important thing before I move on from this exercise, is to explain that the higher Marcus lifts that heel, that's why I don't want him to go more weight. I want him to keep, good job. You can take these things safely to failure. What's the worst thing that happens? He just doesn't get up.
I also like how Ben discusses different ways for scaling the exercise. He points out that simply adding more weight is not the only way to scale the exercise. Other exercise adaptations, such as decreasing the surface area of the support foot or changing the length of the lever, can help to ramp up difficulty when required.
You can take these things safely to failure. What's the worst thing that happens? He just doesn't get up.
Ben encourages his partner to not worry about failure while doing the exercise. Failure may occur when challenging the muscles, but it is of no significance to the overall outcome, and at times may be necessary to achieve the desired goal.
Start with the heel down, whatever's comfortable, never working through pain. Then we add a slant board. Then we put it together, because most people actually don't have strong enough lower legs and feet to even match their knees.
Repetition. Ben uses this tool frequently to hammer home his ideas and to reiterate his key concepts. Repetition is a very effective education tool and a great way to underscore the importance of a particular message. It usually takes 7 exposures to a particular idea before a person will take action on it. So Ben uses repetition to compel you to do something. So what do I think about Ben Patrick, the knees over toes guy? After watching this first video, I see a guy who has taken his own experience with knee pain and pathology and turned it on its head in an effort to become pain-free and more functional. He has distilled his rehabilitation journey down into a few key exercises, and he has developed an effective system of scaling these exercises to make them accessible to people of all levels. He has encouraged and empowered people to take charge of their health and given them a potential treatment that may alleviate their pain symptoms and improve their daily function. All of that is good. But the most important thing that this video demonstrates is the concept that when it comes to rehabilitation of an injury, the only one who is going to make it better is you. The only one who is going to put the work in is you. There are no quick fixes or instant solutions. There is only you and the work that you put in to solve your problems. Physicians, therapists, trainers, Ben Patrick, we are only here to guide you. You have to put in the work yourself. period. So those are my initial thoughts on the knees over toes guy. If you want a deep dive into his podcast interview, then let me know in the comments. Thanks for watching. I will see you for rounds next week. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.